So, Dr. Brunson, please tell us a little bit about your transition from being a member, your various roles as a member, past president, past chairman of the Board of Trustees, and so much more, to now being the executive director of the Mississippi State Medical Association. What have you learned from this process, and what would you like to tell your members that you serve?
Well, thank you for that question. When I look back over my career, I've had a number of different roles, and all those roles I think have prepared me to come and assume the executive directorship position here at the State Medical Association. I started off as a member some years ago, just a member of the association. Started getting to know people, and then they started encouraging me to run for positions, and I started getting on committees and councils, and then I was encouraged to run for the Council on Legislation. And after a second try, I actually won that position, and then from there on to being on the board of trustees, and then chair of the board, and then on to president of the Medical Association. At the same time, I was still working at the University of Mississippi Medical Center as a professor, and I did 30 years over there. And I also had an opportunity to work in private practice down in the rural hospital in Brookhaven, actually, doing anesthesia there with one of my former residents because they were having problems with access to care. When you combine all those, I think what it has done for me is it has given me the opportunity to see almost every aspect of a physician's life, no matter what the work environment is, and no matter what level in this association or other organized medicine or other healthcare entities that I've had the opportunity to work in. What that I believe allows me to do is here as the executive director, try and come up with programs and things that actually works for practicing physicians. And so when they come and talk to me as we're trying to figure out what's going to make this association healthier and the strong organization that it needs to be to properly represent Mississippi's physicians is, and I'm talking to a physician, I can pretty much understand where they're coming from, whether he or she's in the clinic, whether they're working in a hospital setting, whether or not they're working in some other enterprise such as the health department, other organizations such as that. I think all the different things that I've done gives me the ability to relate with those physicians, understand what frustrations they may be undergoing as they try and deal with this very complex and complicated health delivery system, and then asking the State Medical Association to partner with them to make their lives easier so that they can do what they're trained to do, which is take care of patients and make Mississippi healthy.
Thank you so much, Dr. Brunson, for answering our question.